Start. Hi everybody. We are at the Apokos facility today. Welcome to the live session. And we are at Hyderabad right now in the Jubilee Hills facility of Apokos. We are going to be here today taking a walk through the entire facility with Ms. Ashwini Srinivasan. She's the facility expert here, and she'll be telling us everything about Apokos, what are the robotics that they use, the treatments they deal in, the facilities Apokos provides. And yeah, let's speak to her. She's right here. Um, to those of you who do not know what Apokos is, well, it's a rehabilitation center that takes care of patients dealing with traumas or injuries, like brain injuries, spinal injury, and even speech and swallowing for that matter. So let's speak to Ashwini and start the session. Hi Ashwini.
Hi.
How are you?
Soumya. I'm Ashwini and I'm the business development manager at Apokos. So Apokos is a joint venture between Apollo and an Italian company called COS, and we are a 64-bedded inpatient rehabilitation facility. So Apollo is a leading player in healthcare in Asia, and COS is a leading player in rehab in Italy. Okay, so usually we cater to neuro, ortho, and cardiac patients. So the patients come to us usually post-hospitalization, post their discharge from the acute care hospitals. So the process is, once a patient is ready to get discharged from the acute care hospitals, they approach us for their concerned family member to undergo rehabilitation with us. So they come to our facility and we have a process or criteria for admission where they meet one of our doctors, that is either Dr. Anirudh or Dr. Subareddy, to seek approval for admissions. And once the doctors meet the patient attenders, they screen the patient attenders for what is the requirement for treatment for them. And then based on their requirements, we assess what would be the length of stay of each patient at our facility and what would be the treatment plan that they require.
Okay.
As long as they're staying with us. So as I told you, we have various kind of therapies that we do here, which is physiotherapy, occupational therapy, speech and swallow therapy, cognitive behavior therapy, and robotics. So this is a big gym. This is usually where all our patients, come for therapy or are brought down for therapy. And depending on each patient's requirement, we use various modalities and equipments.
Right.
So this is one of our machines called Easy Stand Up. So this is used when we want to initiate standing for our patients. So if normally you want to make a patient stand who cannot stand, we require 4 people to hold that patient. So instead of that, we can put the patient on this, lock their knees, and then help the machine to make them stand independently for half an hour or 45 minutes to initiate standing. And this is our active and passive wax. So the active and passive wax are again depending on how independent they are in moving their upper body or their lower body. There is their hands or legs. So if a patient cannot move their hands at all, we can tune the machine where the machine will move it for them, or for the same way for the legs, or if they are able to do it actively but require some assistance, that can also be set here. Okay, so this is to increase the blood circulation and other things and to help to keep that part of the body active. Okay, and as I told you, we have various kind of therapies. So depending on each patient's requirement, once they visit our facility, or us come and get admitted to our facility, Dr. Anirudh would do a thorough assessment. He will do an evaluation and the assessment of the patient. And depending on each patient's requirement, he would assign different therapies to that patient. So when now this is our occupational therapy.
Therapy.
Yeah. So occupational therapy is nothing but where your upper limb or your hands are involved. This is to get you back to doing your day-to-day activities. So this is where occupational therapists come in. So if you can see, few of the day-to-day activities is dressing up yourself. Buttoning, buckling, zipping, lacing up, and then these are the things that you do at home. You have the door knobs, the gas knobs, the switches, the bulbs, fitters, and all these things. So this is where the occupational therapists come in, where they try to make you more independent in doing your day-to-day activities. Right? Even something as, writing and even eating by themselves is something which is taught by the occupational therapists.
Okay.
So even for spinal cord injury patients, they teach them how to transfer themselves from bed to wheelchair and wheelchair to bed.
Okay.
So this is what the occupational therapists do.
Okay. This is the gym area?
Yes, this is another gym area. This is a smaller gym. Here also the patients undergo therapy. So this is the parallel bar. We use a parallel bar for activities such as sitting to standing and then again walking with support. That is taught in the parallel bars. And as you can see, we have placed some obstacles here. So depending on a patient's requirement, we can also create various obstacles in their path like this. Okay? So depending on a patient's requirement, we can create various obstacles in their path so that we can teach them how to
Basic motor skills.
Yeah, basic motor skills, how to walk when they're walking on the ground, if they face some obstacles, how do they clear it. So all that is also, so we basically think about every small thing that the patient will come across when they are doing that in their day-to-day life.
Okay.
Okay. So next we have the RBO room. So this is one of the robotics. As I told you, we also do robotics therapy here.
Yeah.
So RBO is one of our robotics used for hand recovery. So again, based on Dr. Anil's assessment, he would decide if a patient will get benefited by the use of this robotics.
Okay. How does this work?
So basically it is like, if a patient is able to lift his hand to the ear, but is not able to achieve the movement above that.
Yeah.
And if Dr. Anil feels that by using this machine, we can recover that movements faster, or it is going to aid in the recovery process, then we will use this. And for a patient, it is like they are playing a game on the computer. They won't feel like the machine is making them do the exercise. For them, it is like they are playing a game on the computer, but actually the machine is making them do the movements that they are not able to do normally.
Right.
So it's like basically, for example, for a stroke patient, their brain, whichever part of the brain is affected, that part of the body forgets the movements that it normally does. So when we use robotics, it is like, you are repeating the movement. Like when we are kids, if we wanted to stand, it's not like that one time we stood up, we learned, okay, this is how we stand.
Yes.
It's like we probably fell down and stood up n number of times till that movement got registered in our brain perfectly, that now we do it without conscious. We know this is how we stand. So that is how, using robotics, we get more precision and accuracy in that movement. So this is our room called Balance Master. So this is where all balance, if patient have balance issues, we use the Balance Master to train them in balance training. Okay, so this is the Balance Master. And then moving on, as I told you that we also have another robotic machine called Exo. So Exo is again one of our robotics used with spinal cord injury patients and also with some stroke patients. So this machine helps you to stand and also helps you to walk.
Okay.
So spinal cord injury patients, again, we are very selective about who can use this machine. That is again, they have to go through the assessment process.
Okay.
And then the doctors decide if this machine is going to benefit them or not.
Okay.
And it can be also tuned where if one part of your body is working absolutely fine, you can also tune it to only help do the movements of the other part of the body.
Okay. And how is this used? Does the patient sit on their
Yeah, so it is like a wearable suit.
Okay.
The patient gets donned with this, take measurements, and then set the machine accordingly for each patient.
Okay.
About how much movement has to be achieved in the limbs. And then, that's why I said we have an assessment or a screening process.
Yes.
And then based on that assessment, we would, set the machine in the required mode, depending on each patient's requirement.
Alright.
Yeah.
And on an average, Ashwini, I want you to know, I know that it depends on patient's condition, but on an average, what is the therapy time that this robotic?
So any therapies here are for 45 minutes.
Okay.
Yeah.
On an average.
On an average.
Okay.
On an average, any therapy lasts for 45 minutes.
Okay.
So it's like once the patient is here, all the therapies happen between 9 to 5:30, 9 a.m. to 5:30 p.m. So every day morning they get a schedule, as in how many sessions they have today and with whom. As I already told you, we have various therapy programs.
Yes.
So depending on their requirement, various therapies are allotted, and each session of therapy is 45 minutes.
Okay.
Okay. And now I'll take you to our first floor where we have the patient rooms.
Sure.
Okay. So, and one very common question that we come across is when a patient needs to get shifted to rehab.
Right.
So the appropriate time for a patient to come to the rehab is like post-discharge from the hospital. Like once they are ready from discharge from the hospital, they directly come to us instead of going home. And we are seeing better results with patients who have done that. Instead of going home and they come to us and stay with us, like for a neuro case, the minimum period is 1 month.
All right.
So if they stayed with us for a month, then we have seen that they've achieved maximum results in terms of independence or outcome, and they've at least been independent enough to at least do their day-to-day activities at home, and then they can continue doing the basic physiotherapy at home or even come back to us depending on each patient's requirement. So this is our inpatient area. This is our nursing station. So this is where all the nurses are there. And I'll also introduce to our doctors. This is Dr. Subbareddy,
Hi.
our medical director.
Already medical director.
That's Dr. Anidu, our rehab medicine specialist.
Hello, doctor. So just a couple of, we just want to have a chat with you on, we just took a tour around the entire facility. My first question to you is, what do you think in this country somewhere the importance of rehabilitation after a surgery or after a trauma, after an injury is very low? I just want to ask you, could you share a few words on how important it is? And at Apokos, what makes it so different?
As you rightly said, the rehabilitation concept, the awareness in public is not there. But slowly now people are coming to know about these rehabilitation centers because after getting treatment in acute care hospitals, they have to they used to go home, but they take a long time. After going home, the continuity of care will not be maintained, and then they take long time, especially neuro patients who require intense comprehensive rehabilitation.
Right.
So that was not there before, and then sometimes after stroke they take 3 months, 6 months to become normal and at least to do some activities of daily living. And nowadays we see many young patients with some knee cord injuries and with strokes, and they are the only breadwinners in the family. And then if they take a long time to recover, and then that affect the entire family. So they come here and then they learn AD activities of daily living, and they improve at a faster pace, and then they can go back to the work. So we take patients sometimes in subacute phase in ICU. When they stay in ICU, they develop medical agents, and then they take a long time to recover from this critical illness. So during that subacute phase, sometimes we do get patients with tracheostomies, and then with feeding tubes, urinary catheters, and then we will take care of these patients in our facility.
Okay. And that's what makes Apokos so different from the other rehabilitation. Okay. Also, could you tell us a little more about the robotics that we have here?
And
Ashwini has already taken us through the robotics, the facilities that are there, but I just want to know how does it really help in
Robotics have an extra edge over the manual therapy. Because whenever we go for manual therapy, there are limitations like the endurance of the patient, the endurance of the therapies, the perfection and the accuracy. With robotics, within the same time period, you get more number of repetitions with a better accuracy, better precision. And the movements can be modified according to the condition of the patient. So overall, the duration of stay reduces for the patients, and within the same time period, you can get a better outcome.
Okay. So I think with this, we'll probably take a round of the rest of the facility. Thank you so much for speaking to us. Thank you. Ashwini, let's go. Let's.
Yeah, I'll take you to our inpatient rooms. So we have different types of rooms, which is like sharing room, single room, and deluxe rooms. Okay, and again, depending on each patient's requirements and whatever is the condition that they are coming to us in, the medical team decide which rooms get allotted to the patient.
Right.
Right? So, and all our rooms are also equipped for rehab. Okay, so the as I told you, the difference, sometimes people ask what is the difference between a rehab and inpatient rehab and a hospital. So in the hospital, the doctors are mainly concerned about the medical stability of the patient, whereas we are more concerned about the recovery, the physical recovery, or getting them independent, or getting them back to their life before the episode that they, because of which they ended up in the acute care
Yes.
hospital.
Yes.
So this is how our inpatient room looks like. This is our electronic bed.
Right.
Okay. And then we have central oxygen and vacuum lines like we have in the hospitals for tracheostomy patients and other patients who might also require oxygen. Okay. And we have nurse calling bells, we have TV, we have Wi-Fi, we also have patient-friendly activity boards, and then we all have, this is the attender couch.
Right.
So this is a single room.
Okay.
This is how a single room looks.
Right.
So I will also take you to our sharing room.
Okay.
Please. So as I said, our main goal is to make them more independent. So that is the major difference why a patient requires inpatient rehabilitation.
Yes.
Because maybe a person suffering from stroke is absolutely fine in the hospital, but for them, if they can't use that part of their body or that side of their body, they feel like they've lost something very big in their life.
Yes. Yes.
Right? So that's where we require inpatient rehab setups like this, where they go undergo intense therapies post-discharge from the hospitals. Like they undergo 3 to 4 sessions a day, so that they can get back to their normal life as soon as possible. And if at all we figure out after some time that this is the maximum recovery a patient can have, then we teach them how to use the other side of their body, and make them independent in that way.
Okay.
So whereas nobody feels like they're, that their life has changed drastically, we help them to accept their life and move on, because life must move on. No, it's not like an episode has just stopped their life. So this is how our sharing room looks. It's similar to the single room.
Right.
Right? This is the attender couch. That's the electronic bed with head and foot end elevations, central oxygen and vacuum lines, TV and Wi-Fi. And as I told you, even our restrooms are equipped for rehab. So, you have the toilet seats with bar handles. Yeah?
Right.
And you also have the shower seats with bar handles.
There's literally every bit,
Yeah,
every small
so
thing taken
we
care of.
have paid attention to detail.
Yes.
We have thought about what any patient who comes to us, what are the minimal requirements.
Yes.
We tried our best, and as you know, it's an ongoing process.
Yes.
It never ends.
Yes.
So as we are growing, we are also learning a lot of things, and we are trying to implement a lot of things that can help our patients even better.
Right.
Yeah, and our main goal is to make them recover faster and in a better way in a shorter period of time, because nobody likes to stay away from home.
Yes.
Right?
Yes.
Any day home is a home. But yes, we try to make it a more friendly environment. So there's one more robotic area here called Erigo. So Erigo is like a robotic tilt table. So a tilt table is basically used for patients who have been bedridden for a long time.
Okay.
So when patients are bedridden for a long time, what happens is if you make them sit or stand, they go PBD because of a change in postural hypertension or BP.
Okay.
So what we do is put them on this machine and elevate them slowly at various angles,
Okay.
like 20 degree, 40 degree, and stabilize their heart rate and their blood pressure, and slowly progress them to 90 degree standing, so that we can move them to the next activities, that is sitting or standing.
Okay.
Okay. So we have seen this machine being very useful with our tracheostomy patients and stroke patients,
Right.
and also spinal cord injury patients. So most of our patients are neuro patients.
Okay.
We also have, as I said, ortho and cardiac
Yes,
cases.
yes.
But with so many road traffic uh, accidents on the rise,
Yes.
the traumatic brain injury and the spinal cord injuries are our most common patients, and also because of our changing lifestyle, we see stroke patients also on the rise.
Okay.
So I'll also show you an assisted bath area where we help our patients who have been bedridden, or the patients who cannot move to the bathroom. We get them on the stretcher, transfer them to these areas,
Right.
and we give them a thorough bath.
Okay.
Okay? And this is the machine which we use to transfer the patient. It's called a hoist. So we use a sling and we can transfer the patient using this from bed to wheelchair, wheelchair to bed, or even to the stretchers. Okay? So that there's a minimal risk of injury. So, and also a very common question that comes to us is, what is the difference between us and any other rehab?
Yes.
Right? I know. I'm sure you also want to know.
Yes.
that.
Actually, that was going to be my next question.
Yes. So, firstly, as I told you, we are located in the campus of Apollo Hospitals.
Yes.
So, the proximity to the acute care hospital in case of emergencies, because we also sometimes get tracheostomy patients,
Yes.
so they can have emergencies anytime. So, the proximity to an acute care hospital. Second, having Dr. Subbareddy as a medical director on board also helps us in case of emergencies.
Right.
And also Dr. Anirudh, who's a rehab medicine specialist.
Yeah.
So we other rehabs don't have a physiatrist on board who does the assessment and makes the care plan or the treatment plan for the patients. Yeah. So
We are
other
going back down.
Yeah, we're going back downstairs. So the other hospitals don't have a physiatrist on board
Right.
who does the assessment or the treatment plans or guides the therapist if their therapy is going in the right direction or not,
Right.
and evaluating and screening, bi-weekly.
Right.
So all that doesn't happen in other rehab centers. So, and we have an expert team with a multidisciplinary team approach. As I told you, you have seen the nurses there. You have a 24/7 nursing support, 24/7 doctor's support, an emergency specialist on board, a rehab medicine specialist on board, and then a dietitian on board. So everybody here works as a team, and all of them are like a family here. We don't treat patients as a patient. We treat them more like a family. Everybody can come and share things with us. We understand them and try to support them in the best possible way to recover and make their stay shorter and more, more fruitful.
Right.
Because we want them, when they step out of our facility, to feel that they've achieved what they've come for.